Hello everyone and welcome to Group 5's infectious disease presentation, where we will be giving you a brief overview of protozoal parasites in the genus Cystisospora, which cause coccidiosis in dogs and cats. On this slide are the species which have been identified in cats and dogs. Cystisospora are capable of having facultative intermediate hosts. They are host-specific and there is no cross-immunity between species. Coccidiosis is not considered to be a zoonotic disease. Cystisospora can be found in the normal feces of healthy adult animals. A study by Anderson in 2011 found surprisingly that more cats with normal feces tested positive for Cystisospora than those with diarrhea in a shelter setting. Healthy animals develop an immunity to the infection, which is then self-limiting. The animals most vulnerable to developing coccidiosis are the young and the immunocompromised. The disease is most prevalent where nutrition and sanitation are poor and where animals have intercurrent disease. Other predisposing factors include overcrowding and stress. The parasite causes diarrhea, which may be hemorrhagic, and there may also be vomiting and weight loss. Occasionally, fatalities occur, mostly from dehydration or secondary bacterial infections. The primary route of transmission is fecal-oral, and the infection is very easily spread by fomites. Occasionally, animals are infected by eating an infected paratonic host, such as a rodent. The life cycle begins when the cat or the dog ingests the infective sporulated oocyst, which then invades the small intestine and undergoes a series of asexual and sexual reproduction, causing significant inflammation. It is eventually released in the feces as the unsporulated oocyst, which then further develops in 8 to 36 hours to form the infected stage. Sporulated oocysts are very hardy and may persist in the environment for up to a year. Depending on the species of parasite and the host immune system, the pre-patent period ranges from 3 to 11 days, and oocysts are shed for 1 to 9 weeks. Diarrhea is a very common and non-specific presentation in animal shelters. Coccidiosis is diagnosed by a combination of the signalment, clinical signs, and demonstrating the oocysts on fecal flotation. Cystisospora oocysts are relatively easy to find and measure approximately 20 micrometers. Since shedding can be intermittent, it is preferable to collect a pooled sample of feces from the same animal over a few days, or a single sample obtained from several animals housed together. Fresher samples yield more accurate results. PCR testing can be used to diagnose or differentiate between the different species of Cystisospora, but it is seldom used in a practical setting. Diagnosis of Cystisospora is usually presumptive, and most shelters would have a protocol involving blanket treatment for coccidiosis, along with treatment for other gastrointestinal and ectoparasites at intake. If, however, the diarrhea fails to resolve, then it would be appropriate to collect a fecal sample for examination. Any animal still exhibiting signs of diarrhea after standard treatment should be tested. Fecal testing can be done by an external lab or in-house by a trained and experienced veterinary technician or nurse, who would then make a tentative diagnosis based on the presence of oocysts. The results of the test should be relayed to the veterinarian expediently by whatever means is outlined in the shelter protocol. As mentioned before, the presence of oocysts in feces is not in itself adequate proof that coccidiosis is the cause of the diarrhea. The definitive diagnosis of disease would thus need to be made by the veterinarian, taking the whole clinical picture into perspective. All cases of diarrhea in the shelter should be considered potentially infectious, and animals should be barrier nursed, clear signage posted, and appropriate sanitation measures taken. Staff handling these animals should wear full PPE and move animals into isolation for appropriate monitoring and treatment. Where the index of suspicion for coccidiosis is high, animals should be treated according to the shelter protocol until the veterinarian confirms resolution of the infection. Some clinicians recommend retesting of feces 2 weeks after treatment, but given that Cystisospora can be found in normal feces, I tend to not retest after clinical cure, only insisting that all feces should continue to be handled with scrupulous hygiene. In a lecture at the 2015 BSAVA Congress, Michael Lappin recommended as a rule of thumb to never test normal feces. Hygiene is paramount in managing Cystisospora in an animal shelter. Oocysts require 8 to 36 hours to become infective, so frequent litter box changes are recommended. It is generally accepted that Cystisospora oocysts are resistant to most disinfectants and cleaners, including bleach. Some sources suggest that ammonium hydroxide is effective, but it emits harmful odors which would pose a health and safety risk to animals and staff, hence making its use impractical. For cleaning of cages and the shelter environment, I would recommend following the shelter's usual sanitation protocol, using a product with proven efficacy against the spectrum of pathogens common to the setting, including non-enveloped viruses. Pressure washing may loosen the oocysts from cages and kennel surfaces. Where possible, and certainly before the unit is made available to other animals, it should be additionally cleaned with a high heat steamer or boiling water, as various sources suggest this may be effective. In addition to the PPE, shelters should consider disposable litter trays, food water bowls, and toys which can be discarded after use. Bedding can also be discarded or potentially laundered at very high temperatures. Defecation on surfaces such as grass, ground, or carpeting should be prevented, as these surfaces are not amenable to ready cleaning. Animals should be prevented from predating on rodents which may be infected as paratenic hosts of cyst isospora. As I mentioned before, coccidiosis is frequently self-limiting, but because of the highly transmissible nature of the parasites and their resilience in the environment, shelters should always treat this disease. There are many treatments cited in the literature for treatment of cystisosporiasis, with varying degrees of efficacy. Currently, pernazuril is considered the treatment of choice. In the US, this is available as the equine product Marcus Paste, which is used off-license as a coccidiocide in dogs and cats. Different sources quote various dosing protocols. Lappin and Spindle in 2009 suggest 5 to 20 milligrams per kilograms per os repeated in 7 days. In shelters where coccidiosis is endemic, prophylactic treatment with pernazuril of all puppies and kittens from about 3 weeks of age, repeated in 7 to 14 days, and then as needed, is recommended. In our shelter in the UK, we've used toltrazuril, which is closely related to pernazuril, with great success. It is available as Baycox, manufactured by Bayer. In personal correspondence with Bayer Technical Support in April 2014, it was recommended that we use the poultry formulation 2.5%, off license, for treating dogs and cats. The drug reportedly eliminates coccidia within 2 days of treatment at a dose of 30 milligrams per kilogram per os as a single dose, or 15 milligrams per kilogram per os for 2 to 3 days. We found the drug to be well tolerated at the 30 milligrams per kilogram dose when mixed into a 2.5 ml syringe with some Sloppy Hills AD diet. When we trialed the drug, we found that even litters with large numbers of oocysts in their feces responded very quickly. Within 3 days of a single dose, their feces were solid with no oocyst presence on in-house microscopic fecal examination. Treatment for coccidiosis can be administered by shelter staff as prescribed by the veterinarian. As long as a shelter has the resources to support appropriate isolation, sanitation, and treatment, the policy should be to treat all adoptable animals. To limit effects of environmental contamination, no animals should be released for adoption before clinical resolution of the disease. Animals should still remain available for adopters to view pictures, express an interest, and place holds. At the end of a treatment course, bathing with an antibacterial shampoo or at least wiping down with an antibacterial wipe is recommended. Once cleared of infection, these animals should continue through the shelter process with continued adherence to strict hygiene protocols and daily monitoring for signs of diarrhea. Any adopter would be required to sign an adoption release in case of disease recurrence or pet insurance exclusions. They'd also be given a cystisospora information leaflet. There are no disease-specific home care instructions. All information pertaining to the case should be noted on the animal's individual clinical record for easy access. In conclusion, I would just like to say that coccidiosis in animal shelters is a disease that can be readily managed using appropriate husbandry, sanitation, and modern treatment protocols. Thank you. These are some of the resources and references I used in preparing the presentation. A more complete list of references is available on the transcript document. Thank you very much.